is an undeniable mind-body connection when it comes to stress and disease. But today, I'm going to show you how to use your mind to stress-proof your body by becoming your own best doctor.
Hello, everyone. I am Maureen McGrath. I'm a registered nurse, and I am honored to be at this launch event of probably one of my all-time favorite books of Dr. Bal Pawa, Mind, Body Cure, Heal Your Pain, Anxiety, and Fatigue by Controlling Chronic Stress. We were meant to be all together in person in Toronto at an integrative conference, but as life happens, things change. And so therefore, here we are together on Zoom, and I'm delighted to be here. And I thank you all for attending as well. I would like to say tonight we have some giveaways for you. And also we're going to be taking Dr. Bal Pawa will be taking your questions. And so we'll be providing answers, or she will be providing answers to some of your most pressing questions as it relates to chronic stress and the mind-body cure. Without further ado, I would like to introduce the esteemed Dr. Bal Pawa, author of the Mind-Body Cure. Thank you so much for having this launch event for this amazing book. It's like a Bible for me right now. I just love it. And there's never been a better time to launch this book.
So glad, Maureen. So glad you love it. So happy to be here. And I'm glad that we could do this Zoom event. It's a great way to connect. I'm grateful for technology and grateful for you being a host. I said earlier, this is labor of love. And it really has been truly a passion project. I firmly believe that when patients become involved in their health, and as I said, you become your own best doctor, that's what we're going to find out tonight on how to do that. And when patients do that, the health outcomes are so much better.
So let me start with this question.
Okay.
How does one become their own best doctor?
Well, for me, as you know, I think Maureen knows the story, and many of my patients know the story, and I talk about it in my book. As a physician, I had to navigate this medical system, and I became a patient after a terrible accident. I had just delivered a baby, and I literally hit a truck on the way home, and it changed my life. And as I navigated my chronic pain, the numerous surgeries, the medication, this medical system is wonderful. It's great for intervention, but where there were some pieces missing, that's the deficits I want people to know. You have to become involved. And when I became involved and realized that my autonomic nervous system was a big, big, vital piece of the puzzle, then I just felt I had to transform not just my health, I had to transform so many thousands of patients I've seen, and I had to get the message out there. So that's what this book is about, is that you have to learn to become aware of your thoughts and how they're connected to your nervous system and how the nervous system manifests itself in your physical body. So it's the awareness.
Thank you so much. It's so helpful, and it's such great information for so many people who are dealing with stress, especially in the world we're living today.
Wow. I mean, it was bad enough. Stress was very pervasive. It's common. Everybody has it. So 3 years ago, when I started writing the book, I knew stress was everywhere. Everyone had it. But who knew 3 years ago that the level of stress would go this high, Maureen? And you've seen patients, and Maureen's got a health show. People are very, very broken right now. There's anxiety, there's panic, there's depression. Antidepressants and sleeping pills the prescriptions are going through the roof. So it's time for people to take charge of their health and become their own doctors when it comes to prevention.
That is exactly correct. And so tonight might be the first step for many people to deal with their anxiety and deal with their chronic stress and deal with the symptoms that they're having. And this is a great book in order for them to do that.
Good. That's what I want to do, is give people the tools, give them the way that they can frame it out and have the tools at home so they can start doing some of these techniques. And we'll go through some of these techniques in a minute. whenever you ask me.
Well, that's the thing. Many people today are not only maybe have had a baseline chronic stress going into the pandemic, but adding maybe a job loss or homeschooling or worries about their parents or their families. So what are some of those tools and strategies that people can use today?
So first of all, let's talk about stress. And I think that's important because stress is different for everyone. It's individual, it's perceived, it depends a lot on how resilient you are on already and how much stress you've had over the years because your system then wears down. And so acute stress, everyone knows about, you get panicked, someone cuts you off while you're driving. That's an acute stress. Now imagine if you live like that all the time with the gas pedal on and just revved up, your body's on what we call sympathetic nervous system overdrive. It's like being revved up. And some people just get used to it. And so I wanted people to know that you can actually turn the brakes on too. And there are ways to turn the brakes on. So I have summarized a reframe toolkit that is in the back of the book. It summarizes the whole book. And we'll go through some of these techniques. We can do that now if you prefer. Or
Sure. Why don't we?
Okay,
So, sometimes a person might feel that their heart is racing because of chronic stress, or they might not be able to take a deep breath. So these are some of the symptoms that women and men and people experience during chronic stress.
yeah, you're right. And stress shows up differently in every person's body. I know I hold my stress in muscles. Some people get muscle tension or headaches. Some people get it in their gut. So whatever your weakest link is, that's where your stress will show up. Some people get eczema and psoriasis and rashes. So it manifests differently in each person's body. But
For
the
me,
body,
it's the autonomic nervous system,
yeah, so
which you
get
talk
revved about.
about a lot, and we're going to talk about that a little bit later.
Yeah, so with the reframe toolkit, Maureen, I made it very simple. So reframe is rest, exercise, food, and so reset, exercise, food, rest, and assess, mindset, and evaluation or examination. And so what we want, first of all, when you're out there and you want to say, well, what do I do? What's the first thing I do? Reset your nervous system. The autonomic nervous system is like this engine that I talk about in my TED Talk. And once you recognize this engine is just revving up, it's on default option all the time, you do have a way to turn on the brakes. The rest and repair is the opposite of fight or flight. So resetting the nervous system means taking some deep breaths, deep controlled breathing. That's the first step. And maybe we'll just do a couple of things and then we can keep going.
Sure.
The exercise component is so important. We all know we're supposed to exercise. It's good for you. But imagine if you could just burn off your cortisol and adrenaline when you exercise. What a great way to do that. And exercise great for your immune system. When you pump your muscles, you're actually pumping lymph around as well. Great for the immune system. Food. Everyone knows we're supposed to eat healthy, right? But if you've got a stressed out mind, do you notice that you pick foods that are not so healthy?
Oh, absolutely. And my trigger is fatigue, for example. If I'm tired, it's just go straight for whatever is in front of me.
Emotional eating. So being mindful when you eat and choosing really good foods, the plants, the berries, the nuts, the seeds. So the food is essential for your gut. And the gut is where 85% of your immune system is. So in this book, I try to connect the dots that our body is this one beautiful unit and we've been compartmentalizing it, but it actually works as one beautiful unified unit. And we should look at it as a holistic healthcare rather than just breaking it up into pieces. It's all connected. So that's the first three.
What I love about the book was you make a point to say we make better decisions when we're calm, essentially.
Yes.
And so why is that important, and how does that benefit a person when they are stressed? And it's that you want to take that reset and calm things down, and whether it relates to food or exercise or sleep or responding to somebody versus reacting. Why is being calm so beneficial?
Well, what it is, Maureen, our mind is the decision maker. Our brain is more like this computer that's just playing old tapes over and over, but our mind is what makes the choices and decisions. So we all know eat well, sleep properly, exercise. Those are given. Everyone knows that. But what's the difference between a person who makes better choices and a person who makes poor choices? One is more mindful. They're connected to their higher power, which is their mind. But if we leave it to our brain will just play old tapes over and over, and you will do things just by conditioning and habit. So that's why it's really important. I said awareness is the agent of change. Becoming aware of your thoughts, your choices, your decisions, being mindful, being conscious is the key to everything. And that keeps our nervous system calm, and you will make better decisions that are clear.
Exactly, because chronic stress can have tremendously negative impacts on the body over time. What are some of those things that people may experience after experiencing 3 years of chronic stress, or 5 years, or 10 years, or, many, many years repeated, years of chronic stress and not dealing with it?
So when we get patients who coming into the doctor's office, an astonishing 75% of the symptoms are related to stress. They're often given medication. We have a pill for every ill. And this book is about going to the root cause. Let's fix what's broken. If it is stress, sometimes it is infection, sometimes it is problems with radiation. So we need to look at, well, what are the things that are attributable to stress? And if you take care of them now, you won't get the chronic diseases in 20 years, 10, 20 years, the diabetes, the high blood pressure, even cancer. Chronic inflammation leads to disease. So we should be treating it now and preventing the chronic disease in future.
Ease to prevent dis-ease.
That's it.
And sometimes people think the future will never come. I'll never be 75 years old. I'll never have diabetes. I'll never have hypertension. I'm young and fit and dealing with this chronic stress. So
it happens to all of us, and we call it aging, but there are a lot of people that age really well because they've learned to control their nervous system.
And what would be the first step that you would suggest somebody take today to begin, aside from attending this launch event?
I would say it's 2 steps. Number 1 is the breathing.
Mm-hmm.
Learn how to deep breathe. It seems so simple, but that turns on your brakes. And the rest of the video is going to explain that. And the second thing is being more aware of your mind, the awareness piece, and being more mindful, showing up fully present is probably the second piece. And I have a lovely acronym. It's called SODA. Just stop and observe yourself. Observe. The S is for stop, O is for observe, D is for detach, and A is for affirm. So stop and observe your thoughts, detach from your old automatic thoughts that take you down the wrong path, and affirm some new habits. Our brain is this silly putty. It's like a neuroplasticity machine. We can change our habits if we use our mind to program a new mindset.
Mm-hmm. And it takes a bit, it's not something.
It takes a bit of practice.
Yeah. You may not be able to take that deep breath immediately, but that's why they call it mindful practice.
That's it.
Mindfulness practice. Yes.
Like a car, your brain has a little engine, and it's called the autonomic nervous system. And this autonomic nervous system revs up when there's stress, and that's great. When we had to run away from external dangers like saber-toothed tigers, that fight-flight reaction was important. But nowadays, those prehistoric tigers are replaced by tigers that roam in our mind. Fear of failure, fear of rejection, loneliness, a toxic boss, that busy to-do list. You can't run away from those fears in your mind. They're with you all the time. But wait, the autonomic nervous system has a brake. It's called the vagus nerve. But unlike that other Vegas, what happens in this Vegas doesn't stay there.
And now we're going to have a word from Dr. Nishi Dawan, who is co-founder at West Coast Women's Clinic. She is a tremendous advocate for women's health. And Dr. Pawa and Dr. Dawan have been co-supporters, very good friends, advocates together, almost a sister bond. and in dealing with these issues, these chronic stress issues that people face, and have done tremendous work in this integrative medical clinic that they established together in Vancouver. And also, we're going to have a word from Dr. Gabor Mate. And one of my favorite books that he's written is When the Body Says No. And now a word from the two of them.
What if it is in your head? What if the key to regaining your health is actually in your mind and in your brain? Research shows that more than 70% of today's doctor's office visits are stress related, and the brain makes these powerful chemicals in response to stress that regulates everything from our physiology, our mood, energy, and inflammation. In her new book, The Mind-Body Cure, Dr. Bal Pawa explains how our mind and thoughts directly influence this stress response and shows readers how to reframe, reset, and regain their health. You can change how you feel and have more energy. You can lessen the pain, and you can get your mind to help you. Knowing Dr. Bal Pawa personally and professionally for 20 years, I know she walks the talk. I have witnessed how she has transformed her own health and guided thousands of patients to do the same, using the strategies she shares in her book. She is a gifted physician, an eloquent speaker, and an excellent communicator, and her wish is to share her knowledge and experience to help others. Looking to feel healthier and more vibrant? Read The Mind-Body Cure and learn the tools to get started.
Hi, my name is Gabor Mate. Like Dr. Bal Pawa, I'm a physician in Vancouver. I'm retired from medical practice. I'm the author of a number of books, including one on the mind-body unity, which is also the topic that Dr. Pawa explores in her book, The Mind-Body Cure. And I'm very happy to recommend this book. Now, in medical practice, as it is taught conventionally, we usually just work with the body as if it was separate from the mind. From the scientific point of view, this is incorrect, because what happens in our minds and our thoughts, our emotional dynamics affects and is interactive with every part of our nervous system, with our heart, with our guts, with our blood vessels, with our immune system, with our hormonal apparatus. In other words, it's all one, which also means that when it comes to healing, this unity has to be respected and taken into account and actually utilized for our benefit, which is exactly what Bal Pawa does in her book, The Mind-Body Cure. She paints a very straightforward and I think succinct picture of the mind-body interactions and the mind-body unity, and then using the hard-won lessons that she herself learned after a literally crushing car accident that left her in pain and suffering for years. She then learned how to use that mind-body unity, how to use the mind, the interactions of the nervous system and the hormonal apparatus to de-stress herself, to heal from chronic anxiety and from chronic pain. And that utilization of the unity of the mind with the body, and particularly how Bal in this book works with the autonomic nervous system, the part of our nervous system that we don't directly control, but which is very much responsible for internal states, physiological and psychological, how to work with that system in a positive way, to relax it and to invite its healing actions to our benefit is, I think, one of the great strengths of this book, one of the great virtues of this book. So again, it's always a pleasure to welcome another physician author to the publishing world, and especially when the message is so clear and so needed and so helpful. So thank you, Bal, for writing the book, and thank you for inviting me to speak on its behalf.
You must be very touched by that.
It's been such a great day. It began at 5 o'clock this morning, and I'm just feeling so blessed and grateful to have all these wonderful physicians who also believe in what my message is.
Yes,
so that's
and to hear
powerful.
that, to hear that from such esteemed physicians is so incredible. You know, the autonomic nervous system, which you speak about quite a bit in your book, is a subject typically reserved for physicians. So how can people control their nervous system and become their best doctor?
So, Maureen, the autonomic nervous system, as I explained, I put it very, very simply that it's a machine, it's a motor, but it's actually a bunch of nerve cells. And one of the big nerves, of course, is the vagus nerve, the one I talked about, and then a lot of hormones as well, which Dr. Gabor Mate mentioned, the hormone apparatus. And cortisol and adrenaline are the two hormones. So when they're revved up, that's causing the problem. So as I said, we're automatically defaulted to the stress pathway, but we have to consciously shift into the relaxation pathway. And by doing some deep breathing, then combining muscle relaxation and saying a word. You can say a word, amen, om, when you exhale. So I go through it this way. Inhale deeply, hold for about 5 seconds, and then when you exhale, make your exhale longer than your inhale. And when you're exhaling in your mind, say a word. Now, when you do this 3 or 4 times, if I measured your blood pressure, it would likely drop, your heart rate would go down. And then if I measured your brain waves, the brain waves would go from this crazy pattern of us all running around doing our to-do list, and they would go into these beautiful alpha waves. Now, what that does to your body is you turn off cortisol and adrenaline, and then you turn on things like serotonin, DHEA, growth hormone, all the good things that repair your body. So we're spending a lot of time in fight or flight, but we're not spending enough time in rest and repair. And that's what we need to do, is teach the nervous system to live in rest and repair and only call on the stress pathway when we need it. Make rest and repair our default option, and there's your key to health. An autonomic nervous system seems like such a complicated topic, and it is. It was reserved for doctors and nurses, but I want to bring it to the masses. I want people to take charge, and when they learn to regulate their nervous system, that's when their health begins.
That's just fantastic. Just 3 breaths that I took, and I could feel my heart rate go down.
We measured it in the lab. It was a cardiologist who came up with this at the Harvard Mind Body Institute when I went to learn how to do something else other than deliveries, and I came back transformed after that experience.
Right, and I'm a busy person, and I admit to not taking that time quite often, but at this moment I have this time to do that, and I'm so glad that I did do that. Right now, I'm honored to introduce a very dear person and friend of mine, Sandra Girard. Sandra held a high-powered position at a large organization, and she sensed that there was something off with her health. And she made herself a priority. She became part of her health solution, and she is just the best advocate for becoming your best doctor. And she has an amazing story, and she's here to share it with you all today.
Hi, I'm Sandra, and it seems like perfect timing for Dr. Bal's new book, The Mind Body Cure, to be coming out for all of us. I first met Dr. Bal several years ago in Whistler and soon started working with her in her clinic in Vancouver. And the things we were addressing were hormones and chronic stress. And one of the big stressors in my life at the time was my day job and my 3 to 4 hour commute every day. So I knew that needed to look and feel differently. So intuitively in May 2019, I left that day job and was really looking forward to the next chapter in my life and that journey. About October 2019, I received a stage 4 cancer diagnosis, and I had to become my own advocate and my own best doctor, all the things Dr. Bal talks about as a patient and in her new book. So I intuitively paused and I waited until I had the best doctors that would work with me. And I asked for second opinions and third opinions. And I'm happy to say that my most recent PET scan has shown that it's clear and there's no sign of cancer. And I know for certain that that mind-body connection is a big part of my healing journey of learning to listen to my body and reducing my stress levels. So I know that these times are crazy times and they're stressful, and we have that ability to heal ourselves and be our own best doctors. So wishing you all well, and thank you, Dr. Bal, for all you have done in your support for my healing journey.
And now, a word from Dr. Shimi Kang. She is a well-known psychiatrist and author of The Dolphin Parent, and more recently, Tech Solutions. She's also a tremendous advocate for youth and children.
Hi everyone, I'm Dr. Shimi Kang. I'm a psychiatrist, clinical associate professor at UBC, and an author. Now, Dr. Pawa's book, The Mind-Body Cure, is packed with excellent science-based, practical information that will help you with things like fatigue, anxiety, and chronic pain. How do I know this? Well, first of all, I'm a patient of Dr. Pawa. She's a friend, mentor, but also my doctor. And I suffer from a genetic condition that leads to chronic pain. And she really helped me deal with that, along with the fatigue and anxiety that comes with it. I'm a psychiatrist, and I work with people who, from all walks of life, who are experiencing all types of symptoms related to stress. And her techniques and information have been really helpful to me in my clinical practice. So as an expert, as a patient, and someone who really knows that right now we are in a very stressful world, we need practical science-based tools. That's exactly what you'll find in The Mind-Body Cure by Dr. Bal Pawa.
Wow. To hear from Sandra Girard and Dr. Shimi Kang, both patients, both having had a part and being their best doctor, playing a role effectively with you and their physician. It underscores just how critical playing your own doctor is in your health journey.
It's what makes me want to do more, and that's one of the main reasons I wrote the book. I'm at the sunset of my career. There are a lot of young doctors that I'm trying to train, but when I see patients heal, that's what makes me want to help others. And so if I was just to keep giving them pills and more pills and more pills, sometimes pills are the answer. We have to do both. But often when I involve them in their healing, give them the tools and the techniques, and then I see the outcomes improve, that's heartwarming to a physician. We just want to do more of it. And that's why I wrote the book. And I said, look, let's get the message out there.
Exactly, it's just fantastic. I have to say, I view The Mind-Body Cure as my Bible. It sits on my night table.
That's great. Thank you, Maureen.
I have recommended it to so many people and patients and friends. It's just such a great tool, and it has so much practical advice. It's just fantastic. So I think we're going to take some.
We're going to take some questions, and
did you want
to
finish off our reframe?
Too.
Let's finish off our reframe.
We've gone up to the F, and the R is rest. And a lot of us are on technology, but we want you to take some downtime off technology, because each time you take a little break and go in nature and have some quiet time, that is downtime for your nervous system. Your autonomic nervous system needs to repair, and it's inextricably linked to your immune system as well. So the whole new field of psychoneuroimmunology is your psychology affects your neurology, your nervous system, and your nervous system actually affects your immune system. So with all this COVID crisis, take some downtime, for goodness sake, and give your nervous system a break and your immune system time to repair. And the A is the assessment. What is going on in your head? Look at the dialogue and be aware of your thoughts. And as I said, awareness is a good agent for change. Once you become aware of your thoughts, then you can start saying, oh my goodness, I just thought about all this toxic work environment, and now I've got a stomach ache. So make those connections, and I'll show you how to make the connections in the book. The M is the mindset. That is key. We have to cultivate a mindset of resilience, because stress is not going away, guys. It's always going to be here. And so the stronger we get with our ability to cope with stress, the better we are at responding to stress. We can't change what's outside of us, but we can certainly change our internal environment. And that's what the mindset chapter is. And the last D is a shout out to the doctors. They're working very hard. E's for evaluation and examination. Go and see your doctor when your symptoms are severe. We need intervention. We need doctors. But when it comes to prevention and knowing your mind how it's connected to your body, that's all up to you. That's your homework. That's what you've got to do. But when it comes to intervention, please go and get an examination if your symptoms are severe.
Thank you so much. And what I love about it is having that collaborative approach, working with your doctor,
That's right.
you know, is so important and can lead to a healthier journey.
It's not one or the other.
No.
We need both.
That's right.
But our healthcare system is so overburdened.
Mhm.
And if we can get patients to be involved with a lot of their care and prevention, that just makes sense.
It certainly does.
Right.
Yes, it definitely does. And we've seen that today with some of the patients who have shared their stories, and which I'm so grateful for, because when you share your story like you have, you empower others, and that is so critical. So now we will be
You've got questions
We've got
that
questions.
are
We have some
coming in.
giveaways we're going to be giving shortly. And so we have some questions that have come in, have we? Are we ready for those? All right. Actually, there is, dear Dr. Pawa, thank you so much for your evening tonight and your book. I look forward to reading it. I am a woman who is multitasking on steroids. I'm exhausted with this COVID. I'm worried about my parents, my children, my job, and to top it all off, my husband has lost his. Where do I begin?
Now, that is a typical question, Maureen. You've fielded and I fielded. That is a tremendous amount of stress. And the first thing to do is to go within, because there's a lot of factors that you mentioned you cannot control. So the thing to do is let's control what you can control. And here's what you can control. You can control your breathing. We can't control whether we breathe or not. It's automatic. Your autonomic nervous system kicks in. But the quality and depth of breathing is really important to bring some chemicals into your body that will help to repair. So how you breathe, the deep controlled breathing, the BMW technique. The second thing to do is go quiet in your mind and say, I have a choice. I can react to all of this and no one's going to get help by that. Or I can respond. And respond means to take a deliberate, measured approach using your mind and a reasonable sense, coming from a place of trust and not fear. So all those factors you mentioned, take each one, write it down and say, well, how can I reframe that? How can I reframe that? So if it's little Johnny you're worried about at school, for example, say, well, let's sit down and make some time and space with Johnny, answer his questions, keep him safe. So use information and get safety. If it's your husband's job, then take that and reframe it. So each factor has to be reframed so it works for you and not against you. Otherwise, your nervous system is going to make you sick and you're holding the whole kitty together here. You're probably the anchor in the family. So it's really important for you to go inside, be quiet, reclaim your health, and use some of the techniques in the book. And then you will respond effectively, and this too shall pass, and you're going to be okay. In the end, you're going to be okay.
That is fantastic. And, you know, sometimes people just can't see it, but, you know, it takes often somebody else's wisdom, experience for people to be able to see it. So we have a question. I have colitis. How does stress affect my body?
That's a great question.
It is.
So colitis belongs to the autoimmune diseases. You can get ulcerative colitis. There are various microcytic colitises that come up. And often what I have seen in my experience, when someone is diagnosed with a disease like colitis, what was leading up to that? The 2 or 3 years before that, were their gut problems, was their stress? And usually stress can be a triggering event, an inciting event. But supposing you now have this disease, colitis, you will notice it flares up more when you're under stress. The reason is when you're having a lot of cortisol and adrenaline, it shunts blood away from your gut because your brain thinks you're running away from a dinosaur. And so the blood is shunted away from your gut, your acid secretion goes down, the peristalsis or the normal movement are slowed down. So all the things that repair your gut are not happening. You have to be in rest and digest or rest and repair in order to heal your gut. So there's a very profound link between stress and flare-ups of colitis. And of course, the foods you choose also will impair the colitis flare-ups. But first of all, get your mind into it and then make better choices for your food. And you might need medication if it's severe.
It's a fantastic point. You know, again, we're on that treadmill, and I often hear patients who have a chronic disease, who have exacerbation of that chronic disease, when they stop and reflect, they think, well, this was going on or that was going on. So it's extremely helpful. Thank you so much. We have another question here. How do hormone changes affect stress?
So I think what they're referring to are hormone changes in the female reproductive cycle. Yes, we at our clinic at West Coast Women's Clinic, we see a lot of people with hormonal women with hormonal changes. We see men too, but men have a more steady state with testosterone. Women have this wonderful roller coaster ride every month. And the connection between stress and hormones is that when women are under a lot of stress, the hormones of stress, cortisol, impacts the ovaries. And then that makes the progesterone levels get depleted. Mm-hmm. So when progesterone is low, women are more likely to be irritable, higher level of PMS. They don't sleep as well. Mm-hmm. They might get hot flashes. So they're getting a lot of symptoms with their female hormones, but it might have been because cortisol has depleted some of the progesterone, because cortisol pushes on the ovaries as well. So there's so many links with cortisol. It's not meant to be around all the time. Mm-hmm. And so when we make cortisol, it should be high in the morning, low in the evening, so you can go to sleep. But often our cortisol is disrupted. We'll wake up at 3 in the morning and say, what's going on? I'm so alert. So the cortisol pathways are really important to regulate through the nervous system. They're made through the nervous system.
And I hear so many women speak about sleepless nights, especially during midlife, perimenopause, the years leading up to menopause, menopause. It's important that they become a doctor, their own best doctor in that situation, because sometimes women think they should just put up with it. But that's actually, when they lose sleep, that can affect their productivity, their minds, their mood. It can have so many effects the very next day.
Yeah, we call that the domino effect, right? So you have so many nights that are sleepless, and then you're tired. So then your fatigue, your concentration and memory is impacted, and then low libido, and on it goes. It's a domino. So what do? We go back and try to fix what's broken rather than throwing a pill at every ill. Right. We have to really go back, and that's what integrative medicine is all about, is not just taking the symptoms and treating symptoms, but let's go back and say what caused those symptoms. What is the root cause? And going back to the root cause often will lead you to the autonomic nervous system. But in some cases, if it doesn't, then we treat it. But if it is stress, you've got some great tips and techniques to deal with stress, and that will help some of the insomnia too and the sleepless nights.
Absolutely. There's just so much in this book that will help so many of your symptoms and issues and stress and chronic disease that it's just too much to even say in this one Zoom video. But so that's why I suggest you buy the book, and you can get it at drbalpawa.com. Or you can order it there, or you can pick it up at Chapters and Indigo. But right now, we want to give away a couple of prizes. We have some fabulous prizes here in this, basically this health basket, I would say. It's everything you recommend.
Pharmacy.
Pharmacy.
Yeah.
Here it is. There's some CoQ10 in there and some magnesium.
And there's some great supplements, and I talk about some of those supplements in my book. So magnesium is wonderful for sleep. wonderful for mood. Of course, I want you to use all the techniques I teach you, but sometimes if your symptoms are more severe, magnesium glycinate is a fabulous product. And there are some great other products in there. CoQ10, great for the mitochondria, great for the immune system. And there's a signed copy of my book in there as well.
And the lucky one is Sandy Campbell. So Sandy Campbell is our winner of the Pure Pharmacy Health Basket.
Oh, wonderful.
All right. Congratulations, Sandy. You are the lucky one. We also have another prize package here from Sierra Sil. Fabulous. Many people complain of joint pain, especially as they age. And so there is Sierra Sil's joint formula that is here. These are natural remedies. And there's also some topical pain relief, which is great, and a signed copy of the Mind Body Cure as well. And not to mention the fabulous Reframe Toolkit bookmark, which is so helpful to keep, because we need reminders. And so the winner of this is Ann Stewart. So congratulations, Ann. You are one of the lucky ones. You have won the Sierra Sil basket.
This is a great product.
It is,
They're all
yes.
great products.
Absolutely. I recommend it to my patients all the time. And I've learned so much from you. This has just been fantastic. It's been an honor to be here. Is there anything you'd like to say to kind of wrap up this event, this launch? What would you like to say to people out there who are suffering with chronic stress and chronic disease and illness and anxiety?
Well, first of all, I want to thank you. Maureen has a health show. She's a great advocate for health. Her medical background, she's always a conduit for wonderful, credible information for people. So thank you for the work that you do, because as medical professionals, we could be sitting in our office and just treating patients. But when we're on to something, we want to share that message.
That's right.
And you do as well. When it comes to good information, you want to be out there. So thank you for all the work that you do. And she's got Maureen McGraw's website you must visit and look for some health tips there as well. My message to everyone out there, first of all, thank you for being here on my Zoom call. This is the best we could do with the crisis that we have, but it's been great connecting with you all. I've received so many messages today from patients, from friends, family. I'm just overwhelmed. And today is the day that all this work that I've done has now culminated, but I couldn't have done it alone. It takes a whole community to create an author. So thank you for helping me to write this book. And I've learned so much from my patients. I just want everyone to remember to take the information that's in the book and really advocate and make a plan for your health. And of course, you need to go to your doctor. You need diagnostics. You need intervention sometimes. But there's so much. You have an innate ability to become your own healer. And we have natural forces within us. The father of medicine was Hippocrates. And he said the natural forces that are within us are the true healers of disease. And I'm here to remind you of that. And so please take that message very much to your heart, because it's coming from my heart, and see what you can do to make your health even better. So good luck, stay safe, and I will be seeing you at some point.
And remember, if you want to pick up the book, you can go to drbalpawa.com, or you can walk into, with a mask on, of course, these days, walk into Indigo or Chapters and pick up a book there as well. So you'll thoroughly enjoy it. I want to thank you again so much for sharing your story. I'm so touched, and to read that book and to think about it and absorb it and how it's going to change so many lives, and to think that you have put all of these years of your experience, your health journey, your work, your patients' voices into this work and into this book. Namaste is really all I can say. Thank you so much, and it's just tremendous, and it's been a tremendous evening, and I've been so honored to be a part of it.
Thank you, Maureen, and thank you to everyone for tuning in. Good night.